Hi friends, I am Dr. B.V. Rao of Usha Clinic and founder of the websites qmedicaldoubts.blogspot.com and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary. For the medical knowledge to general people and for reference to medicals. Today I am going to discuss about the kidney urinary tract diseases and prevention. Due to improved social conditions and use of antibiotics in the treatment of streptococcal infections, the incidence of acute proliferative glomerulonephritis has considerably diminished. However, the acute glomerulonephritis may follow a slight throat infection for which the patient does not attend a doctor. Prophylactic chemotherapy is not always practicable. A nephritis can't be prevented by chemotherapy for tonsillitis or tonsillectomy. However, in the event of epidemic of streptococcal infection with a nephrogenic stain occurring in a closed community to all the contacts and carries, prophylactic administration of penicillin should be given. There is no known method of preventing minimal lesion or membranous glomerulonephritis. The occurrence of diabetic nephropathy may be reduced by careful control of the diabetes. Regarding the prevention of the infections of urinary tract, the early diagnosis of the cause and the complete elimination of the infection are very important factors in preventing the development of chronic pyelonephritis. This is very important in asymptomatic urinary tract infection in pregnancy. All pregnant women should be screened with a routine culture of a midstream specimen of urine. An appropriate antibacterial treatment should be given to those in whom bacteria are found in the urine culture. A reference to the section on renal calculi and nephrocalcinosis will indicate various prophylactic measures of value in these conditions, like avoiding certain foods like tomato, cabbage, milk, etc. Acute renal failure may be prevented in some cases with hypotension by prompt action to restore the blood pressure. The incidence of polycystic disease might be reduced by appropriate genetic advice. The frequency of carcinoma of the urinary bladder is reduced by precaution in the gas, dye and rubber industries and also by giving up cigar smoking. A long continued consumption of phenacetin can cause renal damage, in particular necrosis of the renal papillae, terminating in renal failure. The primary action may be on the renal arterioles leading to ischemia. Phenacetin should not be given to patients with chronic renal disease. Patients with chronic renal disease or pyelonephritis and should not be prescribed on long-term basis as for patients of arthritis. Other drugs like antibiotics and possibly the prolonged use of other analgesics may also cause renal damage. Many drugs must be used with caution in presence of renal failure. Lastly, an adequate and early investigations of a symptom as hematuria leads to the discovery of the causal condition at a stage of amenable to radical cure. That's all about the urinary tract diseases and prevention. And in the next video, I'll discuss about some other disease. Thank you.